It's 6 p.m., so it's fine. It's fine.
6 p.m., not bad. So thank you very much. Congratulations for making it to the finals. And I don't know about you, we are very excited to pack you off to Belgium.
Thank you very much. I'm so excited too.
Okay, and as Sarika told, it's just a conversation, not an interview, because since you know that we have big plans for Vattikuti Explorers, and I thought the best thing would be to have first-hand feedback from the first batch of explorers, or what we call them, the ambassadors from different parts, because you have come after a competition, and that's the purpose. I hope you have no problem if we use part or some of or all of your video for marketing, digital marketing purposes. And if you have anything which you would not like to, then please withhold it with you, right?
Okay. No, it's fine. It's fine.
Yeah, fine. So tell me everything about you. Where did you grow up? And, we have enough time. So tell me everything about you.
Oh, well, it's a big question. Well, I was born in Padova, and so I am from Padova, and I'm studying in Padova. I'm from but my parents. I'm from. I'm not. I don't live in a city. My parents were. I would say I'm a first generation medical student, and I hopefully in few months I will graduate, and I will be also the first generation graduate in my family. So I haven't got.
There are no doctors.
Sorry?
There are no doctors in your family.
No doctors, and
What's the business your dad does?
Well, both my parents were worked in a factory, so
Factory.
Blue collars, like they said.
Okay.
And not even any graduates in my family.
Okay,
so,
very good, very good. Yeah. And how many siblings you have?
I have one brother, which is older than me, but it works in a totally different area.
But both of you are educated?
Yes, of course. But I only attended university. My brother didn't.
Okay.
Okay.
So it's very interesting to know that though your parents did not go to university education, but why did they think of educating you, or it was you who wanted to do?
No, it was my choice, of course. And yes, times are changing, of course. So nowadays it's almost a must to go into university, of course. Or at least there is more possibilities that my parents hadn't, maybe. But it was, of course, my choice to go into university, and particularly into medical school. But I said this, I brought up this because I think this is a huge step, a huge thing that I had to overcome, because in order also to be able to enter medical school, because I hadn't gotten a strong education from from early ages, from the early age. I haven't got I had not got resources, books at home, something, or even just like a figure that can encourage you or push you or lead you.
So who supported your education?
Sorry?
Who supported your education financially?
Well, no, Well, economically, my parents, of course, and I am grateful. But
Okay. Is medical education expensive? University education in Italy?
no, not so much, I have to say, because the fee you pay is proportional to basically what
Incoming.
your income is. So, uh,
Okay.
but
And you are not making any money.
no.
No.
I worked a little bit. I did some small work,
Hmm.
especially before the COVID pandemic.
Hmm.
But after the last few years, I decided to focus only on medical school
Hmm.
because it's getting harder and harder. You need to invest a lot of energy and time. So
Okay.
in accordance
So
with my
you were
plans.
doing in some small few hours job in a departmental store or somewhere.
Sorry, I didn't get it.
Where were you working before COVID? You said you were working somewhere.
No, I did a lit. I worked as a waiter
Hmm.
for 2 3 years
Yeah.
to raise to have a little income to pay for my needs, for my basic needs.
So when would the medical students start making money once you become an intern or something?
Yes, after
So after
medical.
you graduate and you do internship and that period they are paid meagerly something, isn't it?
Yes. After your graduation, we haven't a proper intern year, so there is a national test, and you enter directly residency,
Hmm.
and so it's usually it's a 5 year residency, and so from the first year of residency, you get some money, but it's really
Okay. So
in some cities with the cost of living is really.
in this situation, your story is remarkable. In this situation, you had not known what medicine is because no doctor in the family, nobody had done college education. Your parents were very committed, despite not in the field, they supported you whatever you wanted to do.
Yes.
And financially, it is hard to complete medical studies, whatever may be the support from the government. So you had a commitment, so you worked for any menial jobs in order to support part of the education costs of your family. Tell me, what was that strong driver in you to become a doctor? I understood that you had to break the chain and somebody in family should set a tradition to graduate. But why doctor?
Well, I think it is. There are a lot of factors. The first thing that made me think to become a doctor is it's a cliche maybe because I really want to help people. Yes, it's just it's just that.
Okay.
um, but I also have a strong passion for the subjects that are that you need to study in medical school. I really liked I really enjoyed to study, for example, biology, biochemistry,
Mm-hmm.
anatomy.
Mm-hmm.
Um, so I think that going to medical school, I thought that it allowed me to 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 put into practice all of my interests. So, of course, helping people, but also studying subjects that were really interesting for me.
Mm-hmm.
And so I would say that the passion my passion grew over the time. I would say, see, from the first year I started studying, and more I studied, the more I
did you have any role model as a doctor in news or somewhere?
no.
You thought that you should become a doctor. Was there any major research you saw or read in the newspapers or something? Nothing. Just out of a cliche
Yes,
of helping people.
yes, just my strong passion.
Mhm.
Yes.
Okay. Having got on to here, tell me something. When you move to medical college, it is a paradigm shift from wherever you are, whichever is the country. Medical college environment is totally different than your school and family. Do you remember what you carried, you learned from your parents before, which you think that still edged to you?
I would say the commitment, the once you choose something, to put everything into it, to give all, and to be open to make sacrifices even for what you want and for what you have chosen. So yes, I would say
And do you still have school friends you keep contact with?
yes, of course.
Is there anything what you can learn you learned from your best friend during school, which is true, and you say that, well, that was something?
It's I really don't know. It's
Hmm? Anything, no, don't have to strain, but anything, there are few things which stick with you.
uh,
And they don't change with time, they become your traits.
I'm so sorry.
Okay.
I don't know what.
Okay. Tell me, what surprised you when you entered the medical school, which you didn't expect?
Um, I What surprised me. Um, I thought that before entering, I thought there were more competitiveness, and so every medical student trying to overcome the other, or to reach their goals. But actually, I have to say, we really help each other. We are like a family, and I didn't imagine this, because I always imagine university, and especially medical school, like something you have to excel over other. You have to do anything to be outstanding from others, which is of course partially true. But what really surprised me is that we really support each other, and we really help during exam preparation, and we want that everyone succeed. We don't want only us to succeed, but we really help each other, because we truly want everyone to succeed in the medical exams. And so it's
So
a
tell me something. You have cleared your basic anatomy, physiology, biochemistry, molecular biology.
sorry.
What subjects you have covered so far in your medical school?
Well, all the clinical subjects, so
You have
genetic.
completed medicine, surgery.
Yes, I completed a little of clinical. So, for example, gastroenterology, cardiology, and
Did you
now,
rotate to urology?
yes, of course.
And who do you know in your urology department?
Well, my professor who taught me urology is Professor Giacomo Novara. And
What is the name?
Professor,
Novara, Giacomo Novara.
yes, Giacomo Novara, yes, my
Yes, I
professor.
know him because he was trained with Alex Motri in ORSI, and I used to visit him. Giacomo took care of me. He's a very good guy. Uh,
Yes.
do you know Alessandro Holpe, another
Mm,
urologist from Padova?
so who?
Alessandro Holpe.
Oh, yes, yes. I heard about him. Yes,
Yeah.
yes.
So now, have you made up your mind what specialty you are going to do?
Yes, urology, of course.
Urology. Why urology? Why not
Well,
cardiac surgery?
I, it's well, it has lot of positive aspects. For example, I like the variety of the huge variety of conditions of pathologies urology treat, because you have the oncology aspect, but also you have benign pathologies, you have functional pathologies, you have trauma, congenital pathology. So a huge variety of disease, but also a huge variety of approaches. You know, you can do open, you can do minimally invasive, and urology. You can operate in the abdomen, pelvis, or external organs. So yeah, it's and I think it's of course you treat also intimate aspect of the patient, and I think I really have of course I have to build, uh, but I also have the characteristics that can really I can really feel make the patient feel treated, feel cared for, and especially when it comes to these intimate problems that in urology we face. So yes, the
Okay, that makes a lot of sense to me. Uh, how many years you'll take to get to complete urology training as per the Italian system?
it's 5 years after graduation.
So you are planning to get into, and you know that which program you are likely to get into?
No, I don't know because
It's decided at a national level or
yes,
department.
yes, of course
So you have to write an exam.
yes, there is a national written exam, and based on your score, you are and your preference.
When would you know about your things?
Sorry.
When would you know about that which department you are going to work?
Well, if I graduate in next year, I will probably take service around October, November next year.
Okay, okay.
So
So 25, you are going to get into that, you know?
yes, hopefully yes,
Great, that's great.
I will do
Any,
everything.
any interest in research? How do you see research? What's your understanding of research? Why people should do research? Why not only treat the patients? There are many, 80%, 90% only treat the patient. They have good surgeons, they talk well, they operate well. Why some crazies do research?
It's a tough question, a lot of questions. Um, well, what do I know about research? Unfortunately, in Italy, we don't have a strong pathway for medical students to pursue research. Uh, unlike, for example, the USA. But hopefully, in the next few months, I will start my research at my urology department of my institution for my graduation thesis. So hopefully, I will learn a bit more about it. And I'm interested really in research. Why? Well, I think it's a good thing, a great thing to improve the the treatments, the how we treat patients. So of course it depends on what type of research you do, but I think the main purpose of all research is this. It boils down to this. So to understand what treatment to do and what treatment is best for one person respect to another person, patients, and
And I'm sure you are aware of that research is a hard work. Nobody pays you for research.
yes,
No
yes,
time for research. So either you have to take time out of your clinical time or you have to cut on your family time. And you need to have a totally different set of skills. It's not enough to learn good surgery or patient care. You need to have some tools. Are you aware of a knowledge of biostatistics, writing, literature search, thinking in an esoteric way, collaborations? So it's a totally different gamut. And more than anything, benefit to the patient, you rightly said, I do it because it keeps me excited to find solution to complex problems. And it satisfies the ego of leading the world with some cutting edge knowledge. Means you don't only practice knowledge, but you create new knowledge.
yes, yes.
Does that
I
make sense
can
to you?
understand this, and I get excited myself when when new studies are published, and and maybe they are a game changer, you know. And there was a few studies published
Once
lately.
you reach to that level, let me tell you that Europe has one of the best networks for young urologists, whether it's ERAS, EAU. There are lots of groups I know of, and they are doing wonderful research. So once you get there from medical school to urology, you won't complain because, in fact, they are better organized than US and India. India, there is not much of awareness. So you are fortunate to be in Italy and you have San Rafael and some great hospitals. They are leading, European urology, whether it's Francesco Montorsi or uh, uh, you name a person and they are doing great. So you are in a good state. Now tell us something. What's your understanding about this Humbo Jumbo Explorers? What do you understand? What do you want? We want to do. Let me take your perception.
Of the Vattikuti Explorers.
Hmm.
Well, I think it is an opportunity for medical students to to get in touch, to move the first steps um, to understanding, well, specifically robotic surgery with Vattikuti Explorers. But I think it has a deeper purpose to connect people, medical students, and to give them the possibility um, to gain from experts in the field, and which is not just you know, practical skills or just knowledge that you can maybe read or read, but I think it's maybe the mindset, the way to think at problems or at robotic surgery, the expertise. So this possibility to have the opportunity to learn this from experts, I think it's what makes this opportunity unique, really unique.
So you are excited to go to Belgium?
Yes, really excited, really excited.
What is your plan? What are you going to prepare yourself to achieve something from there? What do you want to go with priorities?
To prepare myself. Well, of course, I will study a little more deeper about the different robotic platforms which are available, and so maybe I will come a little bit prepared, and yes,
You
I
make
think
friends. One of my objective is to bring the people from diverse countries and diverse cultures and bring them together, exchange best practices, and create a cross-pollination to create a new breed of international graduates who are not confined by what is happening in their country or their department they know outside, because research is more a collaboration. And you should know how to collaborate with, and our objective is to connect you to the best people in the field you are interested in. So it would depend quite a lot on your active interest in innovations and how we can help you to achieve your objectives.
yes, of course, I'm really interested also into meet different people with different backgrounds, and to know about yes, their perspective also, because I'm here studying all day, and I read a lot maybe, but to have the possibility to listen to different opinions, to different point of views. I think it's really beneficial, both in life in general, and also in robotics, of course, in surgery and any topic you're interested
How
in.
do you plan your personal life? We heard a lot about your plans for the urology and research, but any plans for your personal life, or you are not interested in?
My personal life, I would say that at the moment, I have I really want to graduate on time because of financial burdens, and even so I'm focusing a lot into medical school, into study and giving my exams. Uh, but of course, I have many other interests. So I
Do
read
you
a lot.
study any books? Have you read any books recently?
Yes, of course, I read. I'm currently reading a brief history, *Sapiens*, a brief history of humankind, because I'm also interested in anthropology, evolutionary theories, etc., etc. But I also play instruments. I like to play guitar. I play organ. I try to to improve my skills, my coordination, my hands and foot skills.
Yes.
So I try to
And,
work out. I think I have a good work-life balance.
any good movies you have watched recently?
I'm not really into movies, but
Okay.
I,
Okay, tell me, where did you learn good English? Italians have handicap of good English.
well, I studied a little bit in high school, but I wouldn't say I have strong English. So
But you are much better than many of them. They talk in confidence.
well, thank you very much. Thank you very much.
No, there is a scope to improve, but to be honest, you can communicate. There's no problem in understanding you. And it was not while I'm talking to you, but when I saw your video and read your personal statement, it was clear. So that is a positive advantage you have. At least you would not have regional, limitations which others.
Thank you so much, because this is a great positive feedback, because actually one of my plans on my personal life is to enroll into an English course, because I really want to boost especially my speaking skills. And
Do you keep an interest in uh, national and international issues, political issues, unrest, what is happening? Do you have any chance to keep abreast with what is happening in Italy? And
yes, of course, I'm.
but you don't have any strong political opinions or anything like that.
No, I would say to 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 follow what is happening in the world, and I have my opinions. Of course,
Mm,
I have opinions,
mm.
but I would say they are personal, and so
In
yes,
general, what do you think about the corruption in high places?
corruption. Well, of course, it's. I think it's one of. It's a plug, really, because I cannot think any part of the world, even in Italy. Maybe in Italy we have one of the highest rate of corruption, especially in some parts. But it's really it makes me sad. It really makes me sad,
It's
and angry sometimes. Angry sometimes.
You're right. We, as a citizens, we don't want it to happen, but we are all part of it. And it's
Yes.
difficult to extricate the word. People have given sophisticated terms to it, but it exists, what you said. In some form or the other, everywhere it exists. Okay, if you have any questions, any suggestions about explorers, would you like to ask any clarifications? Because I think it was wonderful talking to you and I got what I wanted to, but you are free to ask me any questions now or later, but now is the best.
No, actually, I don't have any questions, because I think what was
One
written
thing
in
we
the
would
description.
like you to do is to, because we are going full hog on recruiting people who are interested in Explorer program, and you would be our regional ambassador to help us out with all those who are interested in these activities. Because tell me one thing, how did it get to you? How did you know about our advertisement? Where did you see it?
I saw it on Twitter, well, X now. So
You saw it on Twitter?
yes.
Okay, okay. So who are you following in Twitter?
Everyone who is in urology and oncology.
Okay, okay, no
Practically,
kidding.
because I really like to keep updated on what's going on in the world,
Yes.
and the initiatives, and that's why I read about this initiative.
Okay, okay, great. So if you have any questions, you're welcome. Otherwise, thank you very much for your time.
No, I don't have any questions, and it has been a great honor to meet you and pleasure. So
Same here. Same here. Good to talk to you.
Thank you very much.
Yeah. Wonderful. We'll be in touch, and my team will make sure that they will help you out if there are any problems. Thank you. Thank you, Ilya.
Wonderful. Thank you very much.
Have a good evening. And
you too. Good evening. We'll be in touch, of course.